How do we know when our child needs more than just a conversation at home? And what type of care is the right fit? Many parents struggle with understanding the different levels of mental health care. It can feel overwhelming, but my goal is to break it down into clear, manageable steps so that you can confidently seek the right support for your child. So, the first step in mental health care is outpatient therapy, first line of support. For many kids, this is appropriate and the perfect first step in mental health treatment. This is what most people think of when they hear of therapy: regular sessions with a licensed professional that help you talk through emotions, develop coping strategies, and work on personal growth. Outpatient therapy can include different things. So it could be individual therapy where there's a one-on-one approach between a therapist and a child, and they process feelings, manage anxiety or depression, and develop healthy coping skills. Another option is group therapy, where small groups of peers who face similar challenges come together in a structured setting led by a therapist. And this can be incredibly helpful for social skills and emotional validation. Family therapy can also be very useful. Sometimes the best way to help a child is by strengthening the communication and support within the family unit. Family therapy can help parents and children work together on navigating challenges. So, what type of kids are benefiting from just outpatient therapy? This is a child who is experiencing mild to moderate anxiety, depression, or behavioral issues. It's a child who is in school, social life, and family dynamics, but needs extra support. It applies coping strategies outside of therapy. However, for some children, once a week therapy isn't enough. They need more frequent support to manage their emotions and behaviors effectively. That's where more intensive options come in. So the next, IOPs. An intensive outpatient program is designed for youth who need a higher level of care than traditional outpatient, but don't require full-time hospitalization. IOP provides structured, intensive therapy multiple times a week, giving kids and teens more opportunities to build coping skills and emotional regulation. So, what does IOP look like? Kids generally come to IOP 3 days a week for a few hours each time, and they bring emotional resilience, distress tolerance, and healthy coping mechanisms. Attending school while receiving more intensive treatment. So what kids are benefiting from IOP? So generally, it's a child who is struggling with daily functioning due to anxiety, depression, self-harm, or other emotional difficulties. It is someone who's tried outpatient therapy but needs more structured support, and or a child who is with professionals but can still remain at home and in school. IOP is a great option for kids who are struggling but don't need around-the-clock supervision. However, some kids still need more intensive support. And that brings us to the next level of care, which is Partial Hospitalization Program, or PHP. So a PHP is the next level of care for youth who need more structure and support than IOP. How is it different from IOP? Well, PHP is more intensive. They often come 5 days a week program, and they come from roughly, depending on the program, 9 to 3. It's designed for kids who are struggling to function in their daily lives due to severe anxiety, depression, or behavioral issues. It provides a structured therapeutic environment during the day while allowing the child to return home in the evenings. So who benefits from PHP? It's a child who can't manage daily life or school due to mental health struggles. It is someone who needs consistent support to prevent hospitalization. It is a child who has recently, PHP is really providing intensive therapy in a safe, structured setting and helping children stabilize before transitioning to IOP and then outpatient therapy. And then we have the most intensive level of care, which is inpatient hospitalization or residential treatment. These options are for youth experiencing a mental health crisis where their safety or the safety of others is at risk. What is inpatient treatment? So that is a short-term stay in a hospital setting. It's designed to stabilize. It provides 24/7 care and supervision by mental health professionals. It focuses on immediate crisis management, medication stabilization, and safety planning. And residential treatment is a longer-term live-in program designed for youth who need ongoing structured care. It provides comprehensive therapy, education, and skill building in a highly supervised setting. It helps children transition back to daily life after intensive treatment. So who needs inpatient or residential treatment? It would be a child who is in immediate danger due to suicidal thoughts, self-harm, or psychosis. It's someone who has not responded to outpatient, and it's a youth who needs around-the-clock supervision and intensive therapy to stabilize. Understanding these different levels of care is key to finding the right support for your child. Mental health treatment is not one size fits all, and each child's needs are unique. Some benefit from weekly outpatient therapy, while others may need a structured IOP or PHP to regain stability. And in crisis situations, inpatient care may be the safest option. As parents, our job is to recognize when our child is struggling, seek the right level of support, and advocate for their needs. The good news is that there are many resources available, and with the right care, children and teens can build resilience and thrive.